Heidi Nevala, HM, is a graduate of the University of Minnesota with double majors in political science, international relations, and Spanish, and a minor in journalism. Heidi studied master herbalism in Lima, Peru, with expertise in plant and marine-based first-class adaptogen use within South American traditional medical systems. And now I'm going to hand this over to Julie to begin the presentation. Thank you all.
Hi, everybody. I'm really, really excited that we have Heidi. Heidi's a busy woman, and it's really amazing that we finally have connected. Heidi and I have talked lots, but we've only ever met at actually at Super Zoo, and for a short period of time. And I've been so excited. I was telling these guys I was driving today, going, okay, well, when I announce her and when I go, you know, hi everybody, and I'm gonna say I'm such a newbie at this, and then it's like, no, I'm not a newbie, because I'm less. Oh, my pig just sneezed. I'm less than a newbie, and then it's like, okay, well then what's it like kindergarten, Henry? It's like, no, I'm less than kindergarten actually. I'm like preschool, Henry, and because I really am. Like Amazon herbs, I think they're fascinating. I think they're really really, really interesting, but I don't know anything about them, and so I'm really, really excited to hear. She's actually put a presentation, which was really exciting because I didn't know she was going to do that, because not a lot of people go to that work. So thank you so much, Heidi, for doing that. And I'm going to just be quiet and try to learn as much as I can. And yeah, I'm super, super, super excited. You guys are so lucky because she's so freaking busy that no one can get a hold of her.
Oh no!
And so
sorry to everybody.
She's gonna do it for us. She's doing it for us, so we're all very, very excited.
Well, thank you. Thank you. Can you all hear me?
Yeah.
See me? Oh, okay, great. Okay, well, thank you for the introduction.
Kaylin and Steph, I can't see her.
You may be spotlighted.
There we go. Perfect.
Hello. Okay, well, thank you for the wonderful introduction. I appreciate that. I was just musing on how little my majors really have to do with herbal medicine, except Spanish, but we all have a lot of different experiences, and we all land in interesting places, because everyone that's joining in has some kind of area of expertise that we all get to share. So thank you for the invitation and for the time today. I wanted to elaborate just a little bit. So the Amazon rainforest, there are many different types of ecosystems within the rainforest, but we also work with Andean, highland, and lowland herbs, as well as Humboldt current marine specialty extracts as well. So we do have a lot of diversity in our line. It mirrors the ecosystems that we derive our plant and marine extracts from. We actually use over 200. We're definitely going to limit our discussion to just a handful today, but it's exciting to get to talk about these very highly specialized ecosystems, because they're unparalleled on the planet, and there are plants, especially plant botanicals, that they impart different phytochemical nutraceutical values to the animal body, and they really are not, they're unparalleled for diversity. So so I'll leave that little part there. We'll get more into it. I did a slide presentation because this is a very technical topic. I wanted to be as inclusive as possible, and then we'll be really discussing more in depth at the very end some of the herbs that we use. Just as a side point, a single herb could just take the entire hour. There is so much complexity and diversity to it. So, keep it in mind. We're not going to expound on too many. We're always available for consultation from wholesalers or customers or any group really. So please feel free to reach out, and there is contact data at the end of the presentation. So I would like to get right into the slideshow if we could, and I think this is where I'm going to leave off. Okay, all right. So do you have control? Can you still hear me? We didn't lose anything?
We can still hear you. We just need, Steph, you need to change it for Heidi.
Okay.
There we go.
Okay, so the topic today, is urinary tract health. We're going to discuss common conditional needs and then herbal options. And really the whole intent for all of us is to achieve health and wellness at the optimal level for our pets, and we're going to dig really deep into it. You'll see on the left-hand side, there's some of the brands. We're a fairly diversified brand. The common denominator in every one of our brands is, of course, the herbal ingredient deck. So it's exciting to get to highlight this, but we cross-populate them all of our brands because of the incredible diversity. So if you want, we can just get right into the presentation. I wanted to explain what a traditional medical system is, because a lot of people have never heard of it before, and there is a huge differentiator between that and the Western medical system that is primarily the structure in the US. So it's a very different approach to health and wellness in Western medicine. In the US, conventional Western medicine is largely driven by a pharmaceutical model and synthetic isolate medications. There are some, pretty compelling reasons for that, because plants in their naturally occurring state have complexity, phytochemical complexity that is very difficult to isolate. So the Western model is largely driven by isolates, which can be easily researched and marketed as drugs. So another thing about Western medicine that is a very big differentiator between traditional herbal medical system is that it's often about suppressing symptoms to get to reestablish wellness, whereas in a traditional herbal medical system, it is much more driven by trying to determine what root cause is. So I'm going to now pivot into what a traditional medical system is. There's a little bit of detail on there on the slide. I'm going to expound a bit more, because this is a really important difference between how we largely approach health and wellness for our pets, and also two-legged or four-legged in the US versus other medical systems that are more plant or marine-based. So I like, in a traditional herbal medical system, I like that it's largely democratic process. People think that it defaults or favors plant or marine based, but not necessarily. So one of the things that it does do is it assesses all interactions of health, and it assesses, as it says on the slide, the illness and then the relationship between humans, animals, and nature, which is definitely not our approach here in the US. And then it'll analyze both the empirical plant and marine-based knowledge and uses, which is more indigenous-driven, but comparatively against modern medicine. So that includes drug and surgical options. So you see that there is a lot of fairness in their assessment. Once those considerations are made, then the best selection is chosen for the patient, and it may be a combination of both. So I was trained in a medical system that more favors plant and marine-based approaches, but certainly in the overall systemic approach, they're all favored, and ultimately the best decision is made for, in this case, the animal or the person. Traditional herbal medical systems will, if you take a plant like the one we're going to discuss, Chancapedra, in this particular webinar, in a traditional medical system, it would be measured against humans and animals at a common level, at the same level, commensurate. So there is no disparity. It also assesses the impact on the environment. So I just like the comprehensive approach of a traditional herbal medical system, and then the end result is to benefit whatever species we're talking about. So that's a little bit of detail. If you want, we can go on to the next slide. The other part, there's just two parts we're going to talk about before we get into the conditional needs of urinary health or supporting urinary health, because they're a little different. So herbal medical systems, not everybody knows that, but also while many people are starting to know what an adaptogen is, it's not necessarily highly recognizable by everybody. I like using adaptogens because they are highly specialized. In our line, it encompasses plant botanicals, fruit, and marine extracts. But the real caveat is that they're ultra-rative, meaning that they can exert some kind of function or form action against the body that is needed to restore balance. Excuse me. And the end result is really to get change or balance restored. Of course, this predisposes that it's been lost. As we look at our animals or ourselves, it's very hard for us to stay in a constant state of homeostasis or balance. So this is really an important addition to an animal diet, because they function like little body readers. And when I say they're naturally pre-coded, they have these specific actions to them called the 3R function. That's what I termed the phrase 3R function. So there's not only phytochemical and nutritional components, but then there's this other action, adaptogenic action. And in the 3R definition, it's called read, repair, and restore. So the first action of reading is looking for deficiency in the body, some defect or something's awry and out of balance. And it does that again, phytochemically and nutritionally. Then it moves into the reparative capacity, and that's another reason why I really like adaptogenic plants and marine components, because they do have the ability in the adaptogenic context to get into actual reparative categories. And we're addressing like urinary tract health. As we get into this presentation, we see the absolute need for animals to get to that category. And ultimately, the third aspect of it is to restore balance, so restore. And again, all of these, the full spectrum of phytochemistry comes together in these 3 actions. I have on the slide a well-known adaptogen is cat's claw. A lot of people know it. It's been around for, at least in usage in the US, for quite many, many decades. And you can go pretty much anywhere and find it in different formats. So it's an immune modulator and it's primary. I just want to give you an example of why I like to work with adaptogens. And I'll read a little bit about it, not taking up too much time, but it really highlights the functionality of adaptogen context. The immune modulator, it has the intrinsic ability to upregulate or downregulate immune responses needed. Why that's so important is in all mammals, immune response can change literally dozens of times throughout the day, sometimes more depending on what kind of health conditions are presenting. So I kind of liken it, without reducing how serious the plant actions are, as kind of like an intrinsic auto-sensing little ninja, because it can go into the body. And, you know, it's one thing if we have a known condition, let's say there's some digestive upset or some massive autoimmune failure. So that may be a known diagnosed condition, but often not. Our pets suffer from what's known as idiopathic or unknown causes. And this is where an adaptogen, it raises the bar in terms of being able to source, identify root cause and pull together the chemistry, the action of the plants to ultimately try to restore balance. So invaluable, because our pets are now more plagued than ever with different health issues. You know, there's so many interrupters in immune health and as well as urinary health, as we'll get into. So these adaptogen contents have a profound value, potential value. It's also a master body system regulator. Not all herbs raise to that level. Cat's claw is phenomenal in that category. And you see that there's 2 types. There is 2 types of adaptogens. There's a primary first class and a secondary class. While our entire line is not primary first class driven, about 90% of it is. And I prefer them because of the physiological actions they can exert across the body. There's also, in secondary class are kind of more like the supportive role. They have value. Plants in their naturally occurring chemistry have usually somewhere between 200 and 2,000 plant actions. So separating them actually reduces the value of a plant. So I like to use them for that reason. And I guess what we'll probably do is go to the next slide because there's more data on it. So this is where it gets right into the actual topic. So we're taking now the fundamental knowledge of what a traditional herbal medical system is, which is a very different approach than in Western medicine. And then also the adaptogen content. So we're going to discuss at the very end here adaptogen herbs that benefit the urogenital tract. So that it'll all come full circle in terms of relevance. So we know the basic function of the urinary tract is elimination actions for the animal body. For this particular discussion, we're going to focus on dysfunction. That's usually when pet parents are calling us, going to the vet. You know, they're looking for some kind of solution because balance has been interrupted. So normally, maybe more in a clinical sense, urinary health is measured by pH balance. So we're going to kind of approach that first, maybe more in a clinical sense, and just define, you know, what that means. So urinary pH balance is typically measured, well, I should say understood as 7 is regarded as neutral. It's neither acidic or alkaline. Usually an ideal pH ratio for pets, for dogs and cats, is between 6 and 6.5. So anything that's above 7 is alkaline, and anything below is considered acidic. What's interesting in my days or my weeks, I commonly get phone calls from pet parents or even vets that are suggesting that there is some moderation to this. So in other words, that pH balance cannot be the ultimate arbiter of urinary tract health, because some animals are fine at 6, some are fine at 7. So it's just important to understand that, that while it's a system of measurement, it's not always absolute. So we get into common symptomatic responses for animals. If any of you have ever had a dog or cat or any animal that's had either a bladder infection or inflammation or stone or crystal, this is going to be probably something you could have written down yourself, because usually many, if not all of these present depending on how advanced it is. But the common ones are straining to urinate, urinating with pain like vulvization. Cats more than dogs usually do this. Cloudy or bloody urine, and mucus discharge, same thing, can be cloudy, can be clear as well. The attempting to urinate but only avoiding a few drops. Urinating in unusual places. I think a lot of people think that this is specifically a cat default, but dogs do it as well. They just may use other places in the house. Then some parents do see that their animals are exhibiting either stress, anxiety, or they're just too excited to go to void because there's fear. It's a fear-induced response, so that may happen. Increased thirst, that's kind of a general one, but that can accompany it. And then licking of the genital area, loss of appetite. I think hiding and self-soothing is something that's very important to look for, simply because it may be more of a cat-motivated behavior. But you know, a lot of these things, the first part of this, they seem pretty clear. The bottom part's a little bit harder to detect, so you really have to be watching your pet's reaction to know if they have some kind of interruption in their urinary tract health. And then we get into fever, loss of appetite, those kind of things. That's more something you would probably, especially the fever, would determine once you're out of vet office, unless you have some way of measuring, you know, your pet's your temperature. But those are some of the most common symptomatic responses. It's a long list. The reason I put it that way is because there's many different types of urinary distress that animals experience. So if you want to go to the next slide, we'll get right into the reality that maintaining urinary health is a big problem. If you look at the first statement, the UTI, urinary tract inflammation, and infection, crystals and stones, represent the leading causes for vet visits, #1 for cats, and then the top 5 for dogs. This is also a sobering thing. It's one of the primary reasons that dogs and cats are surrendered to shelters or rescues. So we can get a bit more into why that, you know, what the drivers behind that, but a lot of times it's just cost, frustration, and we'll get, like I said, we'll get a little bit further into it. This is the really important part, if you remember anything about this presentation, is just how important it is to get a diagnosis and respond quickly. Because once there is urinary inflammation and infection, there is it varies a little bit by breed and age and other things, other factors, but there is between a 80 and 82% chance that the infection or inflammation cycles become permanent. From there, it's like a jumping off point to compound the problem to become a systemic crystal and stone driven issue as well. So life of misery gets set up if we are not, you know, if we're able to detect those conditional or those symptomatic responses, wonderful. If not, this is just something, a reality that pet parents have to deal with is that if their cat or dog has self-soothed or tried to deal with this issue on their own, they may be inherited a problem, but it's not the end of help. There's natural solutions that we can help address the problem. Of course, there are veterinary interventions as well. But for the purpose of this, we'll get into later on some of the herbal options that you have and why they're so dynamic. If you're reviewing the slide, the main urinary interrupter is alkaline urine usually. I like to use some illustrations. So acidic urine is like a gatekeeper for the health of the urinary tract, the urogenital tract. It allows the acceptable in and also the acceptable out. So alkaline urine, when there's been an interruption, that acidity has been lost, which is it's absolutely necessary for our dogs and cats to be healthy. It opens that gate, destroys the natural bladder defenses. All of us, all mammals, have bacteria naturally occurring in our bladders, but this loss of acidity in for dogs and cats now destroys those defenses, and now bacterial proliferation can take over. So there's that first level of upset. So now when the urine becomes overly alkalinized, that's we're talking about that bacterial and pathogenic proliferation. So now the next step is the minerals collect outside of the urine, triggers infection, and then inflammation and possible infection. So once these minerals are they have developed, that inflammatory cycle gets harder to stop. But usually what ensues is that there's bleeding, the minerals join with other proteins in blood or mucus, and eventually they form crystals that irritate the bladder. So bladder stones are the most common occurrences for cats and dogs in terms of disruptors to the urinary tract. But as we see, there can also be problems with overly acidic urine as well. And that's where the calcium oxalate stones form. So there's a little bit of an intro for that. We can go on to the next slide if you'd like. So there are a lot of reasons that the urinary bladder experiences dysfunction. So autoimmune failure is, kind of a catch-all. It's sort of hard to measure because we're all struggling with autoimmune or immune balance in our lives every day. All mammals are. So what happens though, because any interruption in health is an autoimmune failure of some sorts, so it produces an excessive inflammatory response, goes to the weakest part of the body, and that can cause the launching of a cytokines, which basically causes the immune system to attack its own tissue. Then there are a lot of physiological challenges. So urinary tract infections affect both dogs and cats, but cats definitely have the greater occurrence. Female dogs have experienced more than males because of the physiological, I guess I would say challenge, or the reality that the urethra is shorter and broader than males. So there also is a possibility in cats that if those urinary tract infections are not caught very quickly, they can escalate to kidney infections and kidney disease, which is also in the top 5 common ailments for cats and vet visits. And with cats, that occurrence can happen kind of quickly. Then for the male dogs and cats, they also have an extreme challenge. They're more susceptible to urethral blockage. So what that is, it's almost like a complete obstruction in the urinary bladder that it basically ends their ability to void or urinate. And it's considered an emergency situation. It's life-threatening, it can be. Not that stones aren't either, but a urethral blockage is extremely serious. If anyone ever has that, go right to the vet. Don't use home interventions or herbal interventions, just go straight to the vet. The structural deficiency is the third one on the list. This one's really, usually we don't know it until our animals present some problem in the urinary bladder. There's usually, there can be, I should say, a defect in the bladder or kidney tissue itself. And this is a little bit complex, but usually there's a deficiency of proteoglycans. It's basically a function that keeps the connective tissue moving, elastic, flexible, but also glycosaminoglycans, and those are the reparative, regenerative structural tissue that keeps the bladder in its original position, keeps the walls strong. It's kind of also forms like, those both form like gatekeepers almost to ensure urinary health. The other issue we see in the structural category problems, scar tissue. So a lot of people don't know that crystals forming in the bladder actually can cause trauma and scar tissue. And over time, that can also be a reason why your animal can no longer void correctly, or is now, I guess, set up basically for more bladder infections, or at least inflammation, stones, crystals, and even kidney dysfunction. So another major issue, again, oftentimes is not discovered until there is some, like an infection or inflammation. Environmental, this is one of my passion projects. I could do a whole hour on this, but highly stressful home environments produce excess cortisol production for every mammal. So specific to this discussion, dog and cat, but there can be many animals, there can be new animal additions, there can be disagreements between dogs and cats or same species or anything like that. Behind the scenes, that cortisol production is building up. And then an imbalance can present. And then the interesting role we as pet parents can also drive those anxiety response triggers. So we actually can be the problem, creating these abnormalities of excess cortisol production, stress response, all of that, which directly impacts the urinary bladder. Diet's a huge discussion. Another thing we could talk about for hours, but kind of just listed a few things. The diet, I think most people that are on this webinar are not feeding or likely limiting the dry foods, but we've learned that carbs, starches, sugars, they can alkalize the urine. If you have an animal that's already at risk or has already had some kind of urinary interruption, dry food is in a sense one of the worst enemies. Then we also, at least for phone calls that I take all the time, there's an issue still that continues where pet parents are feeding low quality dry or wet food. The fillers certainly drive inflammatory triggers. There's a lack of that nutritional components that can provoke inflammation. And then interestingly, even on the high end side, so let's say an animal is being fed an optimal diet, maybe it's raw or hybrid diet, dehydrated, freeze dried, whatever, home prepared. Some animals do not, they're not able to assimilate nutrition correctly. So this is another trigger for interruptions to the urinary bladder. So that's another thing to kind of keep on top of. I think the next slide gets into the cellular metagenics. These are tissue abnormalities, bladder tumors or cancer, obviously more serious things, but we'll get into the importance of an anti-mutagenic in the diet. Predispositions by breed, we've listed some of them. There are many more. Some breeds, unfortunately, just are in that category where they're more at risk. This is there's a lot of emergent study on pancreatic deficiency, which the effect of fluctuations of insulin levels in the body causing excessive sugar, driving neuropathy, which directly goes to the urinary bladder. There may be a link between stone formation and oxalate absorption. If you ever want more information, we have it. There's a lot of data that goes behind all these reasons. And then urethral inflammation, that's just a systemic inflammatory response. There may not be an infection present, may not be stones or crystals, but there's just this constant inflammation. I did a video on toxic load, another passion project of mine, how important it is that we're not only assessing our home environments, but also what kind of interventions are we using for our pets. So synthetic derivatives and inorganic compounds collect all over the body, but for the sake of this discussion, in urinary tissue, it's extremely damaging. I liken toxic load in a way, these things that are collecting in the tissue of the body, kind of like static. So you can tolerate it, over time you may adjust and adapt to it, but it's still emitting something that's destructive at a low grade, but systemic grade to the body. And then for some people, pet parents, they use antibiotics and steroids on a regular basis. Very damaging, specifically to the urinary bladder. One thing I think is interesting that some pet parents don't think about is tap water. Unfiltered tap water contains, I've just listed a few, pesticides, herbicides, trace pharmaceutical medications, more than that. But now, there's just in that small category, toxic load, we're looking at drivers for low-grade systemic inflammation, which is a very big problem. Leaking and urinary incontinence, that's kind of we'll get into that a little bit later, but it's a factor in urinary tract health because there's been some kind of decline or change to the tensile bladder tissue, the structural aspect and strength of the bladder. That also makes an animal susceptible to urinary health issues. And then urethral blockage, we mentioned that a little bit. We'll get into that a little bit more too into the discussion, but those are all drivers. So we can go on to the next slide. So there's a lot of types of UTIs. We're going to focus on a couple of them here. I do need to make a statement that we're not encouraging pet parents to sidestep veterinarian visits. Certainly in this genre of health and wellness, a urinalysis and a sterile urine culture is vital. It really gives us so much insight into what's going on in the body. Often we get phone calls of pet parents who are just making decisions or making assumptions that it's the same old problem back again. Certainly do not endorse that, but it does come up. The good thing is in those situations, either we do have herbal decks that kind of cover the gamut of what we're about to talk about in terms of there are many types of UTIs. So cystitis is typically the most common. It starts out as bladder infection. It can be caused by an infection in the bladder. There's gram-negative bacteria that affects the bladder. E. coli is usually the main one. There are others. But it does end up causing painful urine information. Sometimes an animal will have like an extended or swollen abdomen. You'll see blood in the urine. There are more markers in this, but cystitis is kind of a general, can even be an idiopathic category, meaning even when all the urinalysis and veterinarian workup is done, that the exact cause is not known. So in these kind of categories, we see why adaptogenic herbs are so important. Kidney infection, again, same commonality, a lot of times is driven by E. coli or staph. It's more that it moves up the urinary tract from the bladder to the kidneys, and then it causes swelling. Also can be very life-threatening, and then we break down some of the symptomatic response to fever, chills, pain in lower abdomen and back. But you also usually see pus or cloudy or bloody, fishy smelling urine. So that's usually what sends pet parents to the vet because they can detect the scent. Urethritis is it's an infection of the urethra. Bacterial and viral infections can drive this. Trauma can as well. Our pets come, kind of preloaded with all sorts of problems, just like we do. So what's interesting in this category is allergic sensitivity can actually produce inflammation of the urethra. So that's something that is, allergenic presentation is just so common in animals. Who would have thought it could end up in the urinary bladder, but it can. In this particular category, there's usually bloody mucus, discharge, same kind of commonality, painful burning sensations when urinating. That's something you can observe in your animal. And typically animals get to a point where they can no longer cope, so they start demonstrating some of these behaviors to let us know they need help. If you want to go into the next page, we've got a few more there. I know how this is this is very exciting. Vaginitis, infection of the vagina. It can be viral or bacteria. Again, we have trauma. Usually there's some kind of fecal contamination with this. And this one's a little easier for parents because usually the vaginal area will be red and swollen. So there's like a visual that they say, oh, something's really wrong here. Because a lot of times the symptomatic response there is very similar. So frequent urination, or trying to at least. Licking of the vaginal area, then there's the pus and mucus and scooting. Sorry, this is lovely context, but important to know. And then prostatitis. This one is, male dogs and cats primarily, or exclusively, I should say. It's an actual inflammation or infection of the prostate gland. There is way more to this particular health issue, but again, usually there's an infection, there's a massive swelling. What's different here is that in a male dog, it usually can compress the urethra, so urination is directly infected, but it can also compress the bowel. So the blockage or urethral blockage or possibility in this is extremely acute. It comes on very suddenly, and again, life-threatening condition. So sort of the same thing that you would see symptomatically: cloudy or bloody discharge, blood in the urine, straining to urinate, difficulty defecating. So there are all of the types of UTIs, and there's a little bit there's some differences between them, but still good to know, because now you have some markers in case your animal's struggling with this, or you have customers reaching out and describing the conditional responses. For the sake of this discussion, we're only going to talk about the two most common types of stones. There are many. Struvite crystals and stones, referred to as MAP, compositionally magnesium ammonium phosphate crystals and stones, or also known as bladder stones, are usually caused by bacteria in the urinary tract. Again, E. coli keeps popping up, but there's also staph. There's many different types of it. So it is not just solely driven by E. coli. But this is the same part of, or a continuation of this discussion, is that alkaline urine is the culprit and creates an ideal environment for struvite formation. So the interesting thing is magnesium and ammonium phosphate they're naturally occurring in urine. But again, we've got the gatekeeper failing, basically, because now we have a bacterial overgrowth, and the process sets up a stone formation. It kind of works the same way, whether it's struvite or calcium, in a sense that you have an interruption, there's some kind of infection proliferation, and then there is binding of mucus and protein to form crystals, causing bladder irritation, inflammation, bleeding, and then once that trifecta hits, that's when it drives the struvite crystals to form into bladder stones. Not always, but sometimes pet parents can just use some kind of dietary intervention to reacidify the urine and kind of get an upper hand again. It may be enough to dissolve crystals. In my experience, it typically isn't, but there is a possibility, especially if it's the first occurrence in an animal. That's why it's so important as a pet parent to be vigilant about your pet's urinary habits, because then you have some good observational data to react to know if something's actually wrong. But anyway, so a lot of times bladder stones, they're the #1 surgery in terms of stone composition in a veterinary sense. And also, same thing, very serious, can be life-threatening. A lot of times surgical option is the first thing that a vet will suggest. What really gets to be a problem is when an animal is no longer a surgical candidate, like an older dog or cat. I get this phone call all of the time. And the other issue I have is that a surgical option, it's sometimes an emergency, you have to do it, but it's more of like a Band-Aid, because the process, there's some major structural process around the body if an animal has 1, 2, 3, 4 or more stone surgeries over its lifetime. We have a particular product that's called Break It Up, is our best seller. It just gives you an indication that how common stone and urinary tract inflammation infection is in dogs and cats, and there's so very little out there that actually can help modify this problem. So anyway, I'm very passionate about this topic as well. But then we can move on to calcium oxalate. Primarily, it's a kidney driver, kidney stone. Usually a little different provocation for the occurrence. Strong genetic links to kidney stone formation, but also metabolics. Basically, there's too much calcium or minerals present in the urine, and some animals don't have a glycoprotein, calcium-binding glycoprotein, so they can't stop the process. So oxalate stones keep developing over and over and over again. What's interesting is there's also a metabolic aspect to calcium oxalate stones, and we'll talk about that a little bit later. But calcium oxalate stones often presents in dogs and cats who have Cushing's diabetes, obesity, or other metabolic failures. And this is a good example of how the endocrine system is linked to the urinary bladder. We'll get into it just very shortly in a few slides ahead, but why it's so important to know body systems interact on this topic, and which ones do and what do they do. So we'll get into that as well. Calcium oxalate, a little different, less acidic urine is usually needed. A lot of times this is a surgical, usually a surgical emergency. A lot of times calcium oxalate stones are, but again, we do have some herbal suggestions we can make for either side of these most common stones. There are many more. There's cysteine, there's silica phosphates. Anyway, we'll leave it at that for now. These are the two prevailing that you probably hear about as well from your customers. So we can go on to the next slide if you like. this one to me is really exciting. I mean, one of the things that I like to educate pet parents and really anybody that will listen is we really need to look at body systems and how they interact. Because so much of what we do in Western medicine is to suppress a symptom, to consider balance restored, not looking backwards at what other body systems might be involved. Here's what's so interesting about the urinary bladder is that it involves the nervous system and the endocrine system, and we'll kind of break down that autonomic nervous system endocrine urinary link. So, the nervous system is divided into parasympathetic and sympathetic, excuse me. So we've got the rest and digest or fight or flight responses. We're all pretty familiar with that terminology. So what happens is when a stressful event is experienced that an animal cannot self-soothe on their own, the stress overload causes an excess of cortisol hormones and adrenaline. Heart rate increases, blood pressure increases, the immune system gets suppressed. So that's kind of like phase one. Then the sustained stress triggers GABA neurotransmission from the brain to the nervous system. GABA is an anxiety gatekeeper. I guess that's one way to one way to categorize it. It usually inhibits excessive stress response, but prolonged stress can not only change GABA neurotransmission, it can actually damage how GABA transmits to every tissue, cell, and organ in the body. So aside from motor function, it's primarily tasked with managing anxiety. So when that doesn't work or that fails, causes neuroinflammation. That interrupts proper regulation of stress hormones in the body. So again, we're talking about that continued fight or flight response. And then cortisol production kind of takes over, and it goes directly to the urinary bladder. So at this point now, the nervous system's like, I give up, I got nothing else. It gets handed over to the endocrine system. And this is, that's on the next slide. This is the continuation of the decline. So I'm sorry, if you're able, can you go to the next slide? Okay, there we go. Thank you very much. So endocrine system, most of us know is the glandular component of the body, tasked with support, producing and distributing hormones throughout the body. So the adrenals get signaled, and we're still into that phase. Too much adrenaline, too much hormones, it's unbalanced, right? So what happens is now the thyroid, which is one of the main glands that most pet parents know about, but HPA function also gets involved. So hypothalamus, pituitary, and adrenal glands get involved. There's two extremes. Sometimes the glands produce too little hormones, and here's where we all can relate as we age. So when there's too little hormone production, here's the direct link to the urinary bladder. So the hormones are no longer going to the structural bladder tissue, so that tensile strength is lost, and that's where you get leakage and urinary incontinence. That process is kind of a slow decline, but then again, it's a new predisposition for dogs or cats to have urinary inflammation and infection. And humans and animals, similar, not quite the same ratio, but very similar when it comes to hormone production and aging. So by the time humans are, let's say at age 40, roughly, we drop off about half of our hormone production. Again, we hear all about, urinary leakage and incontinence happens to animals as well. Same thing as we age. By the time we age, we hit between the 60s and 80s, depending on your physical health and genetics. Now we're at 10 to 20%. So the body still requires this hormone production, but the glands are failing to meet the needs, and basically it goes right to the urinary bladder. Again, leaking and urinary incontinence is usually what we see, but it can be the other side too, is that it can trigger a pro-inflammatory immune response so that the body attacks its own tissue. So that's just a little bit of a background into how body systems are so directly linked to health, and why I like to use adaptogen herbs, because adaptogen herbs, if you do the right kind of herbal blend component, or maybe sometimes it's just a single plant or marine extract, But if you can use the right blends that can tweak these body systems, you know, back into balance for whatever the prevailing conditional need is, then you can get some real success. And that's really what we're trying to accomplish here, is to not only, I guess, re-support health when it's been lost, but to optimize it. So there's always going to be some other condition or need coming up for our pets. We want to get them past one hurdle so that they can better deal with the next one. Okay, so we can go into the next part because so far it's all been very depressing. So everybody, you know, may have known a lot of the common interrupters, but here's the real question: can we break these cycles? Because urinary infection or inflammation infection, crystal stones are the top 5, number 1 for cat and top 5 for dogs. Certainly this is a big problem. It may be that you're very successful in avoiding this, but most pet parents don't. So they have some kind of major interruption in urinary health. So for this particular discussion, I'm only going to talk about South American adaptogen herbs. The first one will be Chancopedra. You may have heard of it. It's starting to get a little more notoriety. It's kind of one of those, you know, exotic names. People like to say it. It's the whole plant extract is used. Interestingly, it has, so, you know, TCM is kind of usually our marker. It's got several thousand years of use. A lot of people know that. But what they don't know is South American traditional medical system has also been used for, in some cases, 3,000 to 4,000 years, kind of commensurately with TCM. So I like to talk about that because not everyone knows that. The other aspect, I sort of alluded to it a little bit earlier, but South American traditional medical systems, because they assess herbal and plant remedies to humans, animals, and nature, there's this unbelievable body of research and data. Certainly I can supply it at to anybody who'd like to see it, because now we have context for, we like to say, 2-legged or 4-legged companions, right? So Chancopedra, when it comes to urinary tract health, has over 70 plant actions that are specific to urinary distress. Gives you insight into the incredible diversity. So this plant has, it tops over 2,000 plant actions, so it's super complex and exciting. Just to give you an idea of one thing, it's got incredible polyphenolic content. That's one of the major drivers in terms of the success and how it addresses urinary tract health. There's some data on here. I can certainly share the studies if you'd like to see them, but Chancopedra, even as a standalone ingredient, has a 94% effective rate on, we have to qualify this, small bladder, kidney stones, crystals, calcite, gravel, that whole gamut, and has been able to successfully remedy the presence of them within 2 weeks. I need to, again, reiterate that is a small compositional stone, and it was either a single stone or crystal. So gives you insight, though, into the incredible affinity for breaking down a compositional structure that should not be in the body. So the other thing that's exciting about it is Chancopedra is a primary antiolytic. Excuse me. A lot of times, well, generally an antiolytic is assumed to be specific to kidney stone action only, but in this case, it is not. As you see in that study and many, many more, it has an action, broad-based action against all types of stone and crystal formation. So it's very exciting because a lot of, at least in the natural world, a lot of people don't think there is an option for bladder stones or cystine or silica or those kind of manifestations, but there is. I'm going to kind of read through some of the, well, I'm sorry, I'll get to that in a minute. The other thing that's interesting, so there's always, you know, herbs always, or plant botanicals or marine extracts, any of them always have what's called primary, secondary plant metabolites, excuse me. So there's a nutritional component, and then there's kind of like the defense system. So Chancopedra has an incredible array of those two components working in tandem. Interestingly, it's one of the best pain relievers in the herbal world. Documented studies is 7 times more pain relieving than acetaminophen and Tylenol. Very important because when we're breaking down urinary tract health issues, pain is always a constant with infection, inflammation, crystal stone formation, those kind of things. So you see this, what I like to call a wonderful anti-panel. We'll break it down. There's antiolytic, we talked about, anti-inflammatory, it's antibacterial, antiviral. What I like about this plant is it's selectively cytotoxic in terms of its death dealing to viruses and bacteria that are pathogens. However, it selectively protects the native bacteria that should be in the bladder. So when you're looking for maybe an illustration of adaptogen content, there you are. It goes after the invaders, but protects what's its own. So, and that is one of those actions that's pre-coded in adaptogen plants. Amazing. Antimicrobial, need that as well when there's a foreign structure in the body. Antifungal, antispasmodic, very important to relax those muscles that are tense and in flux in a negative way. Excuse me. An immune modulator, we need that as well. Antimutagenic, not everyone knows what that means. An antimutagenic is a gatekeeper. So it is specifically a cellular gatekeeper and a cellular tissue gatekeeper. So again, if there's been some interruption in the tissue, its primary driver is to reset cell health, reset tissue strength, and also, if needed, to break down something that shouldn't be in the body. So it levels up or layers up well with that antilytic action. It's an antimold, diuretic, not strongly diuretic, but it is. Plant-based steroid and antibiotic, very important. Within South American traditional herbal and marine extracts, we have a plethora of primary plant-based steroids and antibiotics. Very exciting, because now you have, again, another option in a natural sense if you don't want to go the synthetic pathway. Hepatoprotective, anti-urolithic. This is one of the really important things. So, up to this point, these are more kind of reactive, supportive plant actions for an active either infection, inflammation, crystal, or stone. But what I really love about Chancopedra is it actually can get into the potential preventative capacity. So, and that's on the gamut of urinary tract interrupters. Really interesting. It helps support smooth muscle function. It's a really important component. If you think about smooth muscles, they're found all throughout the body, and they have a role in urinary tract health for this discussion, because they should basically, let's say, lie flat. When there's, again, we're talking interruption in the urinary bladder health, they sit up on end, and now they're susceptible to viruses, bacteria, pathogens, allergens, you name it. And now it triggers another level of alarm throughout the urinary bladder. So again, another reason why these systemic infections and other issues keep presenting. So, and I did list a little bit of the phytochemistry besides the phenolic compounds. There is a lot of antioxidant value in there: lignans, flavonoids, elagitannins, protein glycosaminoglycans, and one of the many hundreds and hundreds of plant chemicals, this one is called geranium. It directly interferes with the virus's ability to attach to the urinary tract. So another value, you see this compounding value of plant chemistry to protect the urinary bladder. So we can go on to the next one. Okay, so now we get a little bit more into the technical side of how these preventative actions occur. So one of the major things when pet parents have their animals have had some kind of major failure, whether it's consistent just urinary inflammation, it's not a small thing. Bladder inflammation is not a small thing, but that's category, let's say step one, or infection, stones, crystals, that kind of layered approach, because it usually advances. They're worried about it happening again, because they learn that there's a consistent ratio that it will come back over and over and over again. So this is where Chancopedra is very, very interesting. I'm gonna I didn't write all this down or put it all on the slide because it's would be a lot, but I can certainly supply it to you later. Kind of want to walk you through the potential preventative actions that this plant has. Again, keep in mind, this is just one. Usually we recommend herbal, multi-blend herbal ingredients, but this is just one, gives you an idea of the strength in the single capacity. So what happens is performs a variety of actions. One of it is that it blocks cellular irregularity, that antimutagenic action in the bladder and kidneys, and then it resets that cell activity. And then it also, again, scavenges what shouldn't be there. Very interesting, because that's necessary. We have to have that kind of stage one, I guess. Then it goes into the antiproliferative stages. So it's actually working against those urolithial cells that are driven or now kind of have muscle memory, almost with bladder muscle memory, to keep forming stones and crystals like a machine. So so these anti-proliferative actions basically take over in the urinary bladder and kind of kick out the whole process. And it gets to the point where it actually gets into limiting those pro-inflammatory cytokinins that attack the tissue. It can actually just help dismantle that entire process. Another thing that it does is it prevents, this is really interesting, it prevents E. coli, those kind of pathogens like that, from adhering to the urinary tract lining and cells. So it basically shuts down even the possibility of that action from happening in the future. Again, it's in part driven by phenolic compounds, but there's many other actions going on that prevent future urolithiasis. Most times when I'm talking to, I would say maybe conventional vets, they absolutely refuse that this process is possible, but it is, and we actually have tons of research that can prove that this can happen. So it actually gets, has the possibility of getting these animals out of these stone and urinary tract infection cycles for a lifetime of misery and agony. So it also interrupts that enzyme process that is necessary that allows bacteria, virus, and pathogens to multiply. So, kind of slamming the door on some of these negativities or these real drivers for urinary tract disruption. Sorry, excuse me. So we talked a little bit about smooth muscle positioning and how important that is. So the smooth muscle plant actions keep the urinary and biliary tract in a state of homeostasis, at least can help support that. And it also, the smooth muscles, when they've been interrupted, Chankapitra is particularly good at resetting smooth muscle so that when we've got the stone breaking action going on in the body, that it has the right smooth muscle support to expel it. So a lot of times when you're using a plant like Chankapitra for active crystals or stones, you will not see sediment elimination at all because all of these body processes are working in tandem. And again, it's unusual that they're so specific to the urinary tract, but we have, I guess, that benefit with South American herbs that they are, some of them are more, I would say, generalized, but a lot of them are very specifically targeted to conditional needs, which makes it exciting because we can increase the probability of helping animals and getting them out of these horrible cycles of pain and misery. So it also is a fantastic regulator of excess cortisol and calcium in the blood. That's part of the plant chemistry. So it gets right to work to reacidify pH levels, normalize liver enzyme levels, which is incredibly important, and then increase urination. It actually is a modulator of urination. So a lot of people are worried about the diuretic effect. It will regulate that as needed. So that's that slide if you want to continue on. I could go on. I'm not sure where we're at with time. I'm sorry, I didn't really check the clock, and I'm sure there are some questions. There are, like I said at the outset, we work with over 200 plantamarine extracts, so there are so many. That's just one. Some of the other herbs that we use for urinary tract health and maintenance to help support those issues are like Sipa cabelludo. A lot of people are familiar with nettle, uva ursi. Those are pretty common herbs. It could certainly go on and on, but that's just, each of these herbs could be a discussion in and of themselves. Hopefully you get some insight into some of the plant capabilities and actions and the relevance to urinary tract health.
Okay. Wow, that was a ton of amazing information, Heidi. Thank you so much. We're all just sitting here going, wow.
Well, and that's why I did a slideshow, because it's not a small topic, but anyway, hopefully it was digestible. And if not, we have more information we can share if you want to go over it later.
I do have a few questions here, and one of them is, will people be able to access these slides?
Yes, you have them.
Yeah?
They'll be,
Yeah.
they're on the recording too, right?
Yeah, but some people may want them, like if we could hand them out to them if they email us and ask, that would be all right with you?
Yeah, they're pretty general. I mean, there's a lot that I didn't put on there, but that's fine.
Okay, all right. Thanks so much. There's a bunch of questions here.
Okay.
I want to
Any help?
comment first.
Sure,
Okay.
go ahead.
Well, because, having a clinic and dealing with urinary tract stuff for so long, right? Like it's a real problem.
Mhm.
And the analgesic side of it was fascinating to me, because I know with, the old school, when we used to have to catheterize them, especially cats, right? If they blocked,
Right.
and
Right.
still to this day, it does sometimes have to happen. But now what they're using more often is a muscle relaxant, right? And a pain relief. And
Right.
once the urethra relaxes, because it tenses up, because it's in so much distress, right?
Right.
So the fact that it does that as well is really massive from a veterinary standpoint, like really massive.
The thing that's exciting about that aspect, and again, we have a lot more data we could share with you if you want to see studies and those kind of things, but what I love about it is cats and dogs are equally responsive to that analgesic effect. So there's no drop off between species, which is important, because some dogs and cats moderate and handle no matter what you give them differently, but it's safe for dogs and cats. And that pain relieving aspect, you're right, you can use it in other applications, but specifically to this, it's a wonderful compounding effect for this very issue.
Yeah, amazing. Sorry, Kaylin, go ahead.
Okay. Well, there's so Nadia says, any help or remedies for a leaky puppy? She will just randomly dribble or leak. Now, she doesn't give a whole lot of information. If you're still with us, Nadia, can you please give us a bit more information? You say pup, so I'm guessing this is quite young. Maybe while we're waiting for her, I'll ask another one. Beth would like to know, very interested in urinary crystals in dogs, specifically a dog that has both types of
I actually hear this all the time. I have had discussions with people that more in a veterinary sense, that they've taken the position that they can't coexist, but they absolutely do. So you can, and really, and I guess I'm not sure any more details. I don't have more details on this, but you certainly can reach out to me. But it works for Chuckapeter is one of the herbs you could use for on either side. It has that affinity for crystals or stones, and whether they're calcium, oxalate, or struvite driven, it doesn't matter. I'm not sure if I answered that completely.
Yeah, no, I think that was great. We also have another question here. Sorry, I just have to scroll a little bit.
There's a little bit of a delay too, so just so you know, I'm sorry for talking over you.
What can I do? And I'm not sure that this is bladder related, but it may be. What can I do to help get rid of the icky yellow stuff that occasionally comes out of my boy's parts and irritates? He breaks out of his belly and legs where it touches. He's visula.
Oh, yeah.
Yeah, so he has very little hair on his belly and thighs.
Okay, so I'm thinking it's in the prostatitis category, but it can be pH. There's many other different male-driven prostate issues. I'm thinking the pus, she's talking about pus or those kind of discharges that comes from the gland. So yes, we actually have a specific formulation for that it runs, I guess I would say, in reverse ingredient-wise, but parallel to what Chuckapeter does. So just to be clear, Chuckapeter is just one. Usually in these kind of situations, a multi-blend approach is better. I don't usually advocate just throwing an herb, at a conditional need, but absolutely there are not only to whether it's a viral or bacterial infection, what's driving it. I don't know the age or the breed or anything, but anyway, could reach out to me. I'm certainly happy to have the conversation, but there are a specific set of herbs that are driven specifically toward the health and wellness of the male prostate gland in any kind of animal species that are phenomenally successful at helping to remedy the conditional needs of that particular issue.
Okay, perfect. Thank you. Nadja says Roxy is a senior 10-year-old mixed breed.
Okay.
She was the first one I asked. She has random leaks and dribbles.
Okay, so a senior animal, very common. There is that, again, endocrine urinary relationship for urinary incontinence or leaking. Absolutely. I would love it if you actually could reach out to me, because depending on the other conditions that are presenting or known diseases or conditions in the body, we can get more specific on herbal recommendations. There's very great herbs for endocrine, if we're just specifically talking about the endocrine link, and a senior animal, there are herbs that will not only help nutritionally feed those glands and hormone production, because they're at that age, the degradation of hormone production is pretty severe. So you'll start seeing that leakage or urinary incontinence, and we have existing blends, but again, happy to talk to you, can make some suggestions for herbal ingredients or formulations that are very successful in joining the deficiency of hormone production and restoring the health, the tensile bladder structural strength.
Okay. Sally wanted to know, she says, my dog was diagnosed with bladder cancer last year. She had an ultrasound for her liver. They were trying to diagnose Cushing's. She hasn't had symptoms until this last week. Blood in her urine. Also used to have ravenous appetite, doesn't always eat now. She pants a lot too. I don't know if it's pain or Cushing. She still urinates. A good stream, no leaking. But I think Sally wants to know if something like your product would be beneficial for bladder cancer.
So I absolutely cannot speak specifically on that topic. What I can tell you is in our herbal deck, we do have what are considered anti-immunogenic and anti-angiogenic plant actions, and quite a bit of different plants that we use to help address that kind of conditional need. I can never talk about the C word, just to be clear. But we can take a look at diagnosis. We can look at plant chemistry. We can look at plant nutrition or marine nutrition, because or fruit nutrition, whatever is required. And I do, just based on the limited details you've shared, not surprising, all the symptomatic response that you're seeing. Not necessarily just if there's a diagnosis of cancer, but all the other issues that are going on. So absolutely, again, this would be a good reach out to me by email or by phone. We set up something to have a discussion, and I can make some suggestions for you.
Okay. Will, sorry, I'm probably going to mess up this thing. Will Chanka Piedra, did I say that right?
Chacapiedra.
Chacapiedra. Oh dear. Will it work? Sorry, someone knocked on my door.
No, that's okay.
Gallbladder.
It does. Again, for gallbladder stones, it has the same kind of activity. However, there are other herbs that I would make suggestion that are more specific to gallbladder stones. Again, in our herbal deck, we're talking, we mostly talked about kidney and bladder stones. There are many other types, and we have many other herbs. So absolutely, we do have herbal suggestions for that as well, and actual formulations. Get a little bit of flavor in the background there. We're all pet lovers.
Sorry, yes. No. I foster too. I have 2 foster dogs, so it gets a little crazy sometimes.
All right, that's wonderful.
Preventatives. I have a lot of questions about preventative.
Yeah, that's a kind of a trick. I wouldn't say a tricky topic. There are some just urinary tonic herbs that we can make suggestions for. The first default I usually have is any animal over 2 usually benefits from something like an artichoke or a carqueja. Some of those herbs that are tonic, liver tonics, hepatoprotective, have a nod toward kidney health as well. And optimal diet. I guess the best of my ability to do home prepare or to do fresh, real food, right? Not the highly processed, preservative driven, because diet is so much of a big impact on whether you'll have urinary tract issues. Filtered water, I cannot stress how important it is. There's so much junk in our water supply in general, not everywhere, but a lot. Limiting toxic load exposure at home. A lot of people don't know that scented candles, dryer sheets, detergent have neurotoxins. And believe it or not, those neurotoxins translate directly to the urinary bladder. So keeping your home fresh and clear of those kind of things, interaction, exercise, all those kind of things, believe it or not, are really good health preventatives, because they're edifying the body. But if you do want some tonic, I'd say start with like an artichoke or a carqueja. Those are just gentle. They have an effect on the urinary bladder as well. And I can't quite say it yet, but we do have a new product coming out that is in the functional maintenance category. And I say that because a lot of our plants that we use are more responsive to existing, conditions. And the urinary bladder is one of those things you don't want to overload, right? You don't want to use something too strong because that balance is so hard to maintain. So I will table that. We're about 2 to 3 weeks out, but because we get so many requests, and really the number one product, I guess, category that we get phone calls and sell is in the urinary bladder health or urinary health. So we are finally responding to our customer base in many, many years of pleas. And I'm excited about it because it gives not only nutritional options, but general maintenance options for the health and wellness of the urinary bladder. So I think I lost you on volume. So sorry.
Yeah,
I can't
Helen, you're muted.
Oh, sorry.
No, I can hear you now.
Trying to keep my background noise down. Thank you. Julia wants to know, so I'm going to make this the last one. I'm sorry, anybody that we haven't gotten to. We're running over.
Sorry, that's me.
It's okay, man. That was such amazing info. Julie wants to know, my cat is prone to crystals, even though he's on raw, and I give him a ton of water daily. Is there anything else that you could suggest for maintenance and prevention?
Yeah, it's kind of in that same category what we'll be coming out with. But here's the thing. It tells me there's some nutrient assimilation interruption because you're feeding the best diet. Probably the best thing I could do is reach out again by email. I'll send you probably what is basically a blog post that breaks down why the nutrient assimilation happens and why the crystals form, even in the presence of an optimal diet. There absolutely is something you can do. Again, it's probably not, I hate to say chunky Peter's the big guns, but it is a very structurally impacting herb. Probably would refer you to something that's more gentle tonic in nature because you've got the diet in place, but there's a disconnect between nutrient assimilation and urinary bladder health.
Okay, well, thank you. Anybody else who has questions that we did not get to tonight, if you could please direct them to us or go directly to Heidi. If you want to just give us your contact information again, Heidi.
Sure. If you want to reach out to contact@naturaherbs.com. So it's the word natural, no L, NATURA, PETZ as in zebra.com.
Okay, perfect. And I'm going to hand it over to Julie to wrap up.
Thank you so much.
That was amazing. It's you can tell it's just the tip of the iceberg.
Yes.
You sit there and go, okay, so I learned like a fraction. I just want to hear more, right? You just want to hear more and more and more. And I understand it's a complicated thing, right? It's when I try and teach people homeopathy, it's really not complicated, but there's just so much. You just, you kind of feel like you know it, and then you realize, oh my God, I don't really know anything. Look at this and look at this. But anyways, thank you so much. That was awesome.
My pleasure.
Really, really awesome. Thank you very, very, very much.
If I could end with one more caveat, just the basic thing the last thing I want to convey. Thank you all for your patience, by the way. There are so many different herbal, plant, botanical, and marine possibilities. So please reach out. This is really our wheelhouse, and we have a lot of options potentially to help you with the conditional needs of your pets, and we're happy to do so. I really appreciate your time and attention tonight, everybody. Thank you so much.
Yeah, we put it in the chat. We put it again in the chat so the people have all the contacts.
Okay.
And if anybody forgets or whatever, just get a hold of Kaylin, and we will send you all the information right away, and then you can get a hold of Heidi right away.
Wonderful. Thank you so much, everybody. I see some of the comments. Thank you. I appreciate it. This is my pleasure.
Bye, Heidi.
Everyone stay safe and well. Thank you.
You too. You too.